This is my beautiful 56-year-old Caucasian female patient. She came to me wanting to improve the appearance of her face and her nose, and in addition to wanting to look a little bit younger and more refreshed, she shared with me a sad story about her current nasal deformity, that she is a survivor and a previous victim of domestic abuse by her husband. She had what was called a saddle nose deformity, which is almost a complete collapse of her nose and her septum, which is a typical deformity that boxers get when they get hit on the face. She never had this treated previously or corrected, and so she was suffering with this type of deformity. I have performed a facelift and neck lift for her, fat grafting to her cheeks, and an open rhinoplasty. Her open rhinoplasty procedure was more complex than your typical rhinoplasty. As you can imagine from the previous injuries, there was a lot more scar tissue, and so we really have to build up the anatomy or the triangle of the nose to restore a beautiful contour to the nose. What I did for her, in addition to the open rhinoplasty, was I performed a septoplasty. From the saddle nose deformity and the concavity of the anatomy, she had a collapsed septum. So I performed a septoplasty. I used that cartilage from her septum to build back up the triangle of her nose, so that we're correcting not only the sunken-in appearance of the nose, but we're restoring the air passages so she could breathe better. I used her septal cartilage to build back up her septum and her lower lateral cartilages for support, called a columellar strut graft. This surgery is very technical, very technically demanding, and also very artistic, and this is why I love this aesthetic and reconstructive portions of rhinoplasty procedures. In her next photos, you could really appreciate the correction of the saddle nose on her profile.